Hello, my name is Hallie Mingus. I'm a speech-language pathologist, and your doctor has asked me to briefly examine the movements of your face and neck for speech and swallowing. Could I, during this examination, would it be okay if I touched your face and neck and shoulders?
Yes.
Okay. So, I have a few questions. Have you had any further medical concerns or hospitalization since your stroke?
No.
Do you have any current concerns for your speech or swallowing?
I don't think so.
Do you currently have any pain in your neck, head, or jaw?
No.
Okay. Okay, so we're gonna first test cranial nerve 1. For some questions, have you noticed any changes in your ability to smell?
No.
Have you ever been in an accident or had trauma to your head, face, neck, or nose?
No.
Any prior or recent surgeries on your head or neck?
No.
Are you a smoker?
No.
Do you currently have a cold or illness?
No.
Have you been exposed to chemicals in either work or home?
Nope.
Okay, so I'm gonna test your smelling abilities. You need to close your eyes and plug one nostril. And then I'm going to take one of these and hold it underneath your nose. And if you smell it, tell me, and then tell me what it smells like.
Okay. Yes, I can smell it.
What does it smell like?
Peppermint.
Yes, that is what that is.
Yay.
Okay. Now close your eyes again. I'm going to test your other nostril. Okay, do you smell something?
Yep.
What does it smell like?
Lavender.
Yep, that's what it is.
Yay.
Okay, and now we're gonna test cranial nerve 2. So, do you normally wear glasses or contacts?
Yes.
Which one?
I normally wear contacts, and I am wearing them.
Okay. Have you noticed changes in your vision?
Nope.
All right. So I'm going to shine this light in one of your eyes one at a time to see if your pupil changes. So, okay. Now I'm going to hold up this smelling chart, and please cover one eye and read the smallest line you can.
Okay. P-F-O-D-T-E-L.
All right. Now do the same with the other.
Okay. P-F-O-D-T-E-L.
All right. Nice. So now I'm going to hold my hands up, and you need to tell me if they are at the same level.
No. Yes. That one's closer.
Okay.
And then that one's closer.
All right. Now you're going to focus on my nose, and I'm going to wiggle my hands, and you need to tell me where they are. All right. Now I'm going to take this cotton swab and, well, actually first I'm going to draw the letter H, and you need to follow my finger. All right. Now I'm going to bring my finger back and forth and follow it without moving your head. Okay. Now I'm going to take this cotton swab, and you need to follow it. I'm going to put it to your nose and back. You need to follow with your eye. All right, and I'm going to test your peripheral vision, so tell me when you see it.
Yeah. Yeah.
All right, nice. Okay, now we're going to test cranial nerve state. So do you have any difficulty hearing?
No.
So first I'm gonna have you close your eyes, and I'm gonna rub my fingers by your ear, one of your ears, and you tell me if you can hear it and which.
Right. Left. Left. Right.
All right. And was there any difference in hearing abilities on both sides?
Nope.
Okay. So I'm going to hit this and place on top of your head.
Okay.
And then tell me if you hear it equally on both sides or if one side is louder than the other or
Okay.
something.
Sounds even to me.
Okay. Great.
Actually.
And now I'm gonna test your balance, so stand up and walk back and forth. Okay. All right, it looks good. Okay, now can you stand with your eyes closed and your hands out, and then bring your finger in with your eyes closed and touch your nose with both. All right.
Yay.
Okay, now we're going to test cranial nerve 5. So you need to close your eyes, and I'm going to brush this Q-tip on parts of your face, and you need to tell me where it is.
Okay. Cheek. Cheek. Forehead. Side. Jaw. Line. Jaw that side. Forehead.
Okay, now I am going to test your cornea reflex. So you need to look up, and I'm going to, yep, you did it. Okay, now we are testing cranial nerve, the motor part of cranial nerve 5. So can I touch your face?
Mm-hmm.
Okay, so open your mouth, and I'm gonna try and close your mouth, and you need to resist. Good. Okay, now close your mouth, and try and resist me opening. Okay, now I'm gonna try and push your jaw to the left, and I'm gonna try and push it to the right. You need to resist. Okay, do the same the other way. Okay, now can you clench your jaw? Okay, gonna feel for any bulkiness. Nope, you're good. Okay, now we're gonna test cranial nerve 7. So you need to close your eyes and stick your tongue out. And I'm going to test if your taste buds, and you need to tell me if you taste it and what you taste.
Mm-hmm. Sugar.
Taste sugar. Okay. Great.
Yay.
Okay, now we're testing the motor portion of cranial nerve 7. So, do you have any good jokes?
I don't think so.
Okay, could you frown for me? Could you raise and lower your eyebrows? Like, can you open your eyes really big for me? And then I'm gonna push down on your eyebrows, but don't let me. Okay, good. Now close your eyes really tight, and I'm gonna push up on your eyebrows, but don't let me. Okay. Can you smile and show your teeth? Now pucker your lips and say ew, ew,
Ew, ew.
Inflate. Can you inflate your cheeks? And then I'm gonna push on each cheek, but don't let the air out of your lips. Okay, good. Okay, now we're gonna test the sensory portion of cranial nerve 9. And it's going to be a tasty one again, so you need to close your eyes and stick your tongue out. And I am going to put something on this Q-tip and put it on your tongue. And you need to tell me if you taste it and tell me what it is.
Salt. Yes. Yep. Salt.
Okay, great.
Mm-hmm.
Okay, now I'm testing the motor portion of cranial nerve 9. And so I'm gonna have to feel your throat, and could you just swallow for me? Okay, do it again.
Okay, let me get some spit.
now I'm gonna take this and you need to open wide and I'm gonna brush. I'm gonna test your gag reflex. Great. Okay, now we're testing cranial nerve 10. And could you sustain ah for me?
Ah.
Can you do that again?
Ah.
Open your mouth wide. Okay, good. Could you please cough? Is that how you normally cough?
Yes.
Okay. Can you give a sharp grunt 3 times?
Is that right?
Did that feel normal?
Oh yeah, there we go.
Did that feel normal?
Yes, what's it?
Okay, could you also say ka ka ka?
Ka ka ka.
Okay. Oh, can you do that again?
Ka ka ka.
One more time.
Ka ka ka.
Okay, great. So I need you to, this is cranial nerve 11, and I need you to shrug your shoulders up and resist me pushing them down. Okay, great. Please turn your head to the left, and then resist me. And then to the right, resist. Okay, great. Now lastly, we're going to test cranial nerve 12. And so, could you please open your mouth and stick out your tongue? Now move your tongue in and out of your mouth repeatedly. Okay, now please point your tongue up, down, to the left, and to the right. Okay, so now can you please stick your tongue out? Can I touch your tongue?
Mm-hmm.
Okay, now don't let me push your tongue in. Don't let me push it to the left or to the right. So, okay. Please push your tongue to the right cheek, and I'm going to push against your tongue with my finger.
Oh.
Okay. Now put your tongue in your left cheek and resist me pushing on that side. Okay, so that is it. Thank you. The testing is complete, and I'll inform your physician of your results. Do you have any additional questions for me?
I do not think so.
Okay, great.